Welcome to you all, I hope I'm sure we're going to have an excellent day. This should be the first of many rehabilitation conferences that we have here, and it's particularly fitting that this should be the first one in this magnificent new building, the Sid Watkins building, and hopefully we can give you, I think there's a virtual tour that's going to occur, and we may be able to arrange a tour of the building for those who are interested later. And it's particularly fitting that it's about rehabilitation. I mean, Sid Watkins, for those of you who don't know, was the doctor who really did so much to make Formula One racing so much safer, and he was a neurosurgeon. And there have been many spin-offs into sort of civilian road safety that have come from that as well. And I'm sure that he would have been a firm advocate of, well, if the damage has occurred, what one should at least do one's very best to ensure the efficient and as effective a repair as possible, and rehabilitation is as effective as possible. It's also fitting, I think, that it's about rehabilitation because the main clinical use of this building is going to be will be for rehabilitation. There are 30 complex rehabilitation beds in, I think, the state-of-the-art facilities on the ground floor, and then another 12 beds for those patients who have particularly behavioural and cognitive challenges following a brain injury. They're going to be on the first floor, and then also some rooms for relatives to stay in if their loved ones are in intensive care or for various reasons that travelling is particularly difficult. And then we've got the education facilities on this top floor. So it's particularly fitting that the first conference should be about rehabilitation. And the other thing is this is Brain Awareness Week, and obviously the vast majority of the rehabilitation that occurs is neurorehabilitation, and this is Brain Awareness Week. There may be some TV cameras around later on, and that's why that's the case as well, as long as some other news event doesn't eclipse it. Sorry, I had to get that in somewhere. I'm sorry, I had to get it in before everybody else who gives it to, as long as some other news events doesn't eclipse it. So anyhow, we've got an excellent day lined up, very varied program really. We're starting off with something about brain mechanisms in and how that can affect rehabilitation, followed by something about the organisation of rehabilitation and assessment of the outcomes from that. Then there's something about our local experience here. Then after lunch we turn to the military rehabilitation of neurotrauma. Now, just pause there and say, I mean, the recent wars have taught us many things, but one of them, I think, has been indirectly of great benefit to medicine, because it's shown that with organisation of acute medical services, and this is obviously in the theatre of war, but it also holds true in other acute medical services, with the better organisation and greater effectiveness of acute medical services, there are increasing numbers of survivors. But survival isn't just all about survival, and the quality of life thereafter, and optimising the quality of that survival has become far more, well, the focus has gone onto it far more, and I think there's been an indirect spin-off into other branches, into civilian medicine, and I think this came along at the same time as there was a lot of work around trauma and trauma networks, and people have put two and two together and actually got the logical answer of 4 of the need to expand rehabilitation services. And I think as evidence of how effective that can be, not only for the individuals but for the whole system, the whole health system, as that evidence emerges, hopefully, well, I'm sure we would all hope that more and more resources will be put into what has previously been a very neglected part of medical and health care. So we then pass on to The whole being, the psychological and psychiatric effects of brain injury. And then we finish off with an intriguing talk from Dr. Wade about, well, what are the risks, what are the possible harms? And I look forward to hearing his thoughts on that. So I think a varied day, very stimulating day, a great day for our brains. I think also the inner man is going to be well looked after. We've got our lunch sponsored by Slater and Gordon and tea by Allergan. And I also thank them very much for that, and also our other sponsors, Ipsen and Mertz. So I will shut up at this stage. I'll introduce Nick Fletcher, who, for those of you who don't know him, is I was going to say one of the stars of his generation of neurologists. Actually, I'll change that to the star of his generation of neurologists, I think. He's the clinical lead for neurology, long-term conditions and rehabilitation here. He's been the clinical lead for the team who's put together this conference. He, just on a personal note, he is the vital support and wise counsel for me in my role. And so I give you Nick Fletcher, who's going to whip you in for the rest of the morning anyhow. Thank you, Nick.